All right, we're back with Chapter 16, the reassessment. The topics that will be discussed in this chapter are going to be specifically the reassessment process. And again, we will discuss the reassessment in this section. All right, so during the reassessment, you want to repeat key elements of the assessment procedure that you have already performed. So that is where you're going to start to identify any changes or trends that have been happening. And remember, you shouldn't skip a step, or you shouldn't, skip anything except for when there's life-threatening interventions that prevent you from doing so. So you're going to identify changes. They might be subtle or they might be very obvious. Again, you're going to check those trends. You're going to check for any deterioration and any improvement that may be happening. You want to be sure that every time you do something that you are communicating with that patient, explain the process and what you are doing, and then consider the patient's feelings such as anxiety or even embarrassment. Younger teenage girls, might be embarrassed. It might even be the situation that you're in. If it's a sexual assault or an abuse by a male on a teenage or even a early 20s female, or a female in general for that matter, or it could be male, you don't want the opposite sex in there. So if it's a female, you want to try to have a female with you. If it happens to be a male, then you would probably go more so with the male responder rather than the female, and vice versa. So components of the reassessment include repeating the primary assessment and recheck for any life-threatening problems. So you're going to reassess the mental status, and maintain the airway, monitor the breathing rate and quality, reassess the pulse rate and quality, and then monitor skin color and temp, and reestablish patient priorities. As far as pediatric goes, you want to note that the mental status of an unresponsive child or infant can be checked by shouting, which is that verbal stimuli, or flickering of the feet, which is that painful stimuli. So crying is an expected response from a child with an adequate mental status. So if you get out to a call and you have a pediatric patient who you think should be crying, so say a motor vehicle accident with significant injuries to the adults in the vehicle, and that baby is not crying, you should be worried. Crying babies are good babies in our world. Then you want to reassess and record any vital signs and compare the results with the baseline measurements. You're going to reevaluate the oxygen saturation and document any findings that and record, and again, identifying any trends that you happen to catch along the way, no matter if it's going up or going down. So something to think about. So think of an example of a problem that might develop into a life threat to the patient on the way to the hospital. So come up with some ideas. Think about those and what you would do with them. So you're going to repeat any pertinent parts of the history and physical exam, like the chief complaint, which may change as you go through your assessment, especially with regard to the severity of it. And then you want to ask about changes in symptoms, especially the ones anticipated because of the treatments that you administered. And then at that point, you're going to repeat that physical exam. Then you're going to check your interventions. So you want to ensure that the adequacy of oxygen delivery and artificial ventilation is good. You want to ensure management of any bleeding and ensure adequacy of any other interventions that you took. Here they're just checking for interventions that they had already previously taken care of. All right, so another thing to think about, describe an example of an intervention that might need to be reevaluated and discuss your process for examining it. Next, we're going to talk about observing trends. So you want to repeat that reassessment steps frequently. You want to notice and document any trends. And in trending, you want to find the changes in the patient's condition over time, no matter if it's improving or deteriorating. And then trends may indicate new treatments or adjustments to ongoing treatments. So maybe the patient was having chest pain and you had a blood pressure of 90/50, but now 20 minutes into your transport, now the patient's complaining of chest pain again, but his blood pressure is 180/100. Would it be adequate to give nitro at that point? Yes. Now, granted, I'm not saying that ever happens, but I'm just giving you that as an example. And during those observing trends, you're going to reassess and record any vitals that you have taken and are now going to retake. So the reassessment for stable and unstable patients. So first is the patient condition, as well as the length of time with the patient will determine how often you reassess. So again, on stable patients, you can reassess every 15 minutes and unstable every 5. But before, even on a stable patient, you should always get used to doing at least a reassessment on them before you arrive at the hospital. And again, the more serious patient conditions, the more often you will actually reassess them. So when are you going to reassess? Again, like I said, and I will repeat this 100 times so you will remember it in your brain. Every 15 minutes for stable patients, every 5 for unstable patients or potentially unstable patients, and if you believe that there may have been a change in the patient's condition, and repeat at least the primary assessment. All right, that was a quick, simple chapter, but we will do a quick chapter review. All right, so your reassessment is the last step in your patient assessment. You should generally reassess a stable patient at least every 15 minutes and an unstable patient every 5 minutes. Elements of reassessment include repeating the primary assessment, repeating and recording the vital signs, repeating pertinent parts of the history and physical exam, and checking any treatments or interventions you performed for the patient. Treatments you need to check include oxygen, bleeding, spinal motion restriction, and splints. Reassessment is vital for noticing changes in the patient's condition. Trending can help determine if a patient is improving or deteriorating. And reassess frequently and record new assessment data. Questions to consider. How will reassessment differ for a stable patient versus an unstable patient? Remember that a stable patient needs to be reassessed less frequently, and the reassessment will likely not involve as many steps for that stable patient, whereas the unstable patient will need to be reassessed more frequently, and you're probably going to focus on many more steps that are involved. Critical thinking. You are caring for an unstable patient who was involved in a motor vehicle accident. The patient has crush injuries to the chest, fractured bones in the lower right leg, and bleeding on the forehead. The patient is unresponsive. You have inserted an oral pharyngeal airway and your partner is manually ventilating the patient. You have also placed a spinal immobilization device on the patient's neck. And for this critical thinking, what reassessment steps will you need to complete for this patient?